Well, it is 1 o'clock Los Angeles time in sunny Los Angeles, unlike I'm sure what Mr. Dr. Noya has with his snow I saw. So a little different weather around the world and around the country. But welcome, everyone. We are very glad that you have joined us for the Care Exchange, listening, learning, and lifting each other up for Hilarity for Charities, CareCon 2026. Caregiving has a way of teaching you things you can't learn from a book, a degree, or a training manual. And today is less about who's the expert in the room and more about what we can learn from each other. We've brought together family caregivers, a physician, a social worker, and a lawyer because caregiving doesn't happen in silos. It happens in real life, where medical decisions, legal questions, and everyday realities all collide. This is meant to be a listening session. We all look forward to hearing honest stories, sharing perspectives, and hopefully walking away with a deeper understanding of what it really takes to care for someone and for ourselves along the way. So, first of all, to my panelists here, thank you for joining us today at CareCon 2026. Glad to have you. If I
Pleasure
may
being here.
start Thank you. If I may start with Jessica, you are an educator, speaker, and millennial caregiver with over 10 years of personal and professional experience. You care for your mom full time, and you have created an online community known as Career and Caregiving Collide. So, my first question for you, Jessica, is when you hear the phrase honoring lived experience, what does that mean to you in the context of caregiving?
Yeah, great question. Hello, everyone. And it's so, actually can't see you, so I don't want to say it's so good to see you, but it's nice to see all the panelists. And thank you so much for being here. As Jeff shared, I've actually been a caregiver for my mother who's been living with Alzheimer's disease for the last 11 years. And I have navigated everything from being a long distance caregiver to now living in my childhood home, caring for her as she is now navigating the late stage of Alzheimer's disease, fully bedbound, no longer ambulatory, 7D on the fast scale, and our second time on hospice. I come to you today sharing from a wealth of experience navigating our PCP, hospitals, palliative care, home health, as well as home care agencies. So that's where I'm sharing from when I share what I believe when I say lived experience. I think there's two prongs. There's the lived experience for the family caregiver. I often say, as family caregivers, you were more than a caregiver. You were somebody before you said yes to caring for someone, and you will be somebody beyond this experience. And it's important to acknowledge that you have strengths, perspectives, experiences that add to your understanding of how you want to show up as a care partner to your person. And it's important not to diminish those things, but actually to think about how can my experiences make me a stronger care partner to my loved one. I think the second prong is when I say lived experience for the medical professionals, the healthcare providers that we navigate with, is acknowledging that family caregivers, they're not just entering as the person who brought that individual to an appointment. They are entering as someone who is the expert in their loved one. They are entering as someone who has thought through all of the questions, has strong opinions, has a very full plate, and wants to be leaving your appointment or your visit feeling empowered and equipped to be able to care for their person well. And so when I think of lived experience, it's like honoring the fact that we are full humans with values, belief systems, and things that are driving our decision making, driving what we want to be true for the care of our person. And that has to be reflected in the ways in which we engage together and navigate the care of our people.
Thank you for sharing, Jessica. Gerald, did you prefer Jerry?
Jerry would be great, Jeff.
You got it, Jerry. Well, Jerry, you are a principal of the Rothkopf Law Group, where your practice serves clients in the areas of elder law, life care planning, asset protection, veterans benefits, estate planning, and long-term care advocacy. So, Jerry, can you share a moment when a caregiver's lived experience changed the way you approached care, communication, or decision making?
Well, thank you, Jeff. Thanks for the question, and thank you for inviting me to CareCon. It's great being here. Jessica, first off, I love your enthusiasm. So I hope I could be enthusiastic with my answer. I, the answer. to answer the questions, I would say it's progression. It's not a one-off where, oh, the light went off and said, okay, this client needs this. I need to provide those services. It's progression. When I became an elder law attorney, I've been doing elder law for over 26 years. I originally thought the law can solve people's problems. They come with me with a problem. It's like, okay, dad is incapacitated. There's no financial power of attorney. We need access to his checkbook to pay the assisted living community that we just moved him to. That's a legal technical question. The problem with that is that I've learned over the years, the law is just one piece of the puzzle. Each of the panelists add to that puzzle, and collectively, using our collective brains, we can address the needs of caregivers and those they're caring for. But the issue is the law doesn't solve all the issues. People were coming to me with non-legal questions that it was probably even more important than legal, such as how do we take the keys away from dad? How do we convince mom to go into an assisted living memory care community when she refuses to leave the home? How do we address dad's issues with the for losing money to sweepstakes sales or and such like that, or romance scams, which I think we all have experience working with our clients with. Those are legal questions, but those are important tangentially related to what we do. So I realized that in order to provide full service to the client, I need to bring in non-legal advocacy. And it's care advocacy. It's getting the best care. It's not how do we save the money from the nursing home. It's addressing our clients' needs. And that's geriatric social workers, which we have in our practice. We have a death doula in the practice. It's all collectively related to addressing the needs of the client, which the law in isolation does a poor job of solving. So we together have to solve those puzzle pieces together. And that's what we do. And that's the best way we can advocate for the clients, is to provide a holistic, multidisciplinary approach to care advocacy and assisting the caregivers and those they are trying to care for.
Absolutely. Thank you, Jerry. If I may go to Dr. Noya next. You are a physician and a long-distance caregiver to two sisters who are experiencing cognitive decline. Caregiving teaches you things no training ever could. So, Dr. Noya, what is one lesson caregiving has taught you that changed how you show up, perhaps now in a different way for your patients, following your experiences in supporting your sisters? Oh, if you don't mind just putting yourself off of, you're on mute right now, Dr. Noya. Thank you.
Yeah, I knew that was going to happen. Yeah, so I'm from Peru, and I've been away from Peru for the past 45 years. And so first I went through my mother's dementia in the late 90s, and she passed away in 2010. And now with my sisters, and both have been distance affairs. Uh, in With my sisters, I'm having more a role of caregiver than with my mom. My mom was more like a witness. And anyway, your question, I had a lot of difficulty with that, and I was talking about that with my wife yesterday, how to address that, because for the past 45 years, I've been caring for children as a physician. And in pediatrics, the child is not your only patient, but also the child's caregivers are also your patients. And so I'm just thinking right now that maybe that has informed me more to caring for my sisters than the other way around,
Mm,
right? Because it's 45 years of doing this. And anyway, so I think that the bottom line is that whichever way it is, it doesn't matter. And I think one situation informs the others, and I think it sort of like enhances your feelings of empathy and solidarity with the persons you're taking care of, be it my patients at the hospital or being my sisters in Peru. That's
absolutely.
how I would put it.
Thank you. Thank you for sharing, Dr. Noya. Lisette, if I may go to you next. You are a bilingual licensed social worker and work as a brain health care manager with over 18 years of experience in the field of gerontology. Did I say that right? I believe I did.
Yes, you did.
Gerontology. Good. Specializing in dementia care. So, where do you see disconnects between systems, including healthcare, legal, social services, and the real lives of caregivers? And where do you see opportunities to do better?
Wow. That's a very important and full mouth question you just gave me right there, Jeff. And I'm going to respond to that question. But before I do that, just like Jessica mentioned, even though we're not able to see our audience, I want to express gratitude for all of the people who were able to join us here today, for all those friends, for all those family members, for all the informal caregivers that, considering the multiple responsibilities they have, they were still able to join us here. I'm very hopeful that they're going to be able to gather some meaningful information for through their participation here with us today. Going back to your question, I will mention that I believe that personally the disconnect between the systems and the lived experiences of the caregivers has to do with the unintentional, I don't want to say forgetting, but I want to say with the failure for us professionals representing different systems to really listen to what the informal caregivers have to say. Uh, the caregivers, the informal caregivers, are major players in the care journey. And it is, unless we had Jessica's and we had Dr. Noya's coming here to support the well-being of those care receivers, the care journey is not going to go as effective as it should be. And a lot of times, as professionals, we are so eager, so passionate about supporting the caregivers because they're also going to support the care receivers, but we try to follow a structure and we do not give them the time to listen. We do not give them the time to talk. And you mentioned before, I don't know if it was you or Jessica, this is a listening session. And that's exactly what caregivers, informal caregivers need. They need to be listened to. Unless we listen to them, we're not going to be able to learn. And unless we learn about their experiences, we're not going to be able to put together, just like Gerald mentioned before, the synchronizing of all the services because we don't know what really is that they need. We come up with assumptions about what the needs of caregivers are, how can those needs be satisfied, and we forget that the care journey is not a homogeneous experience. It is different. It's different across cultural groups, socioeconomic groups, racial groups, from one family to the next, from one caregiver to the next. So we have to be mindful of that. That it's not just creating programs and services, it's about listening and learning so we can support the caregiving experience, but according to the person's needs, not according to what we believe is the right thing. And we come with very good intentions, all of us as professionals, right? But unless we really listen, we're not going to be able to provide what the caregivers really need. So I believe that unless we become more proactive about listening and learning, we're not going to be able to bridge the disconnect between systems and what caregivers needs. And if we help caregivers, we helping care receivers because it's a mutual relationship. That's what the social workers do, as Gerald clearly identified within his practice, was able to notice. Maybe the support that social workers, I'm sorry, can bring to the table. I think Jeff is frozen now.
Is Jeff
Oh,
frozen?
yeah, that's what it looks like.
Well, at least he's smiling. Could be worse, I guess, right? Uh, so, um, uh, so I can take over with some questions. Hopefully, he gets unfrozen. I
I'll
guess.
I'll just comment real quickly
Sure.
while he's unfrozen. I just wanted to say I completely agree with everyone. So for the audience, I'm Dr. Esio Seguidaro. I am a assistant professor of neurology. I have subspecialty training in stroke, vascular dementia, Alzheimer's disease, and so I diagnose and care for patients with dementia. And I agree with what all of my colleagues have said about there being a disconnect within the healthcare system and what caregivers and patients need. And I think what we need to do in healthcare is start listening more. Because once we listen to caregivers and we listen to patients and we can figure out what are the needs, then we can tailor the services that we deliver and tailor our healthcare delivery to meet the needs of patients and their caregivers. But in addition, use a multidisciplinary, a multi-community approach. So it's partnering with legal team, partnering with social worker, partnering with caregivers, advocacy groups, patients, community leaders to figure out what resources can we create so that caregivers and patients are set up to navigate this dementia diagnosis.
My apologies too. This is the glory of Zoom. I guess my internet went out for a moment. My apologies, everybody, but glad to be back. I want to make sure I give Dr. Ayudaro, who also is on call. So thank you for joining CareCon 2026 while you're on call. We appreciate you. But Dr. Ayudaro is a physician, a researcher, a neurologist, and a neuroscientist. And your current research focuses on understanding the role of racism in neurological disorders. So I know you've already been speaking, but if I may go a little further on that, when it comes to caregivers and healthcare providers and such, where would you say if they all came together and started from scratch, where do you believe that would be different?
Repeat that last part again. I think you went out.
Yeah, absolutely. So my question is, provider system together from scratch, what do you believe would be different?
Did anyone else get the
Yeah, it says if caregivers, healthcare providers, and legal professionals were designing a system together from scratch, what would be different?
I think it would
Thank you,
be,
Dr. Noya.
thank you. Thank you for that. Be patient-centered, patient-focused, and we would include more, we would leverage the resources that the community has to offer. Because I think, unfortunately, parts of our healthcare system can be very fragmented. You see one physician for your heart, you see another physician for your brain, you see another individual for community support, you see a social worker, you see the nurse, you see all these different individuals, but instead of the patient and caregiver seeing 20 different individuals, if we came together and really created a patient-centered approach where instead of the patient meeting all of these specialties, the specialties came in a room, we talked about the patient sees one person, and we can deliver that care and deliver the needs that the patient has in just one visit instead of multiple visits and multiple touch points. I think that would be what the difference that this new care model would make. It would be very patient-centered, patient-focused, and addressing the needs of the patient and the needs of the caregiver.
Absolutely. I want to make sure, can you guys all hear me? And I apologize to the audience too. I hope you're hearing me okay. Can you guys hear me okay? Awesome. Glad to hear. So if I may now go back to you, Jerry, from your perspective, what does good collaboration between caregivers and professionals actually look like in practice, not in theory?
Well, let me just follow up with what the doctor just stated. With what we have in this country is everyone is in their own silo. So and that is in, as the doctor just stated very eloquently, that's very inefficient. There's been some trial programs out there, like the GUIDE program that I'm sure some of you are familiar with, and I never can remember the acronym. Guiding and improved dementia experience or something like that is, but it's a trial program and it's only for a select few, where it's a multidisciplinary way where Medicare will provide reimbursement, where you have the neurologist, the social worker, the occupational therapist, et cetera, all together and providing one, and there's a continuity of care there. We need more of that in this country. Of course, I would argue we know it works and we don't need an 8-year trial program to show what's already proven. But that's just me talking. I will stop pontificating. But when we talk about the, what the collaboration, education, we need an educated, activated patient in addition to the educated healthcare professional. People need to be educated. And so people need to, the doctors, what was already, and other healthcare professionals need to understand, and the patient needs to understand, it's a team approach, and the caregiver is part of the care team. And that's the most important part, because they're the ones who have to deal with it after they get direction. Their mom is discharged from the hospital or discharged from the subacute facility. Then they go home. They're left to their own devices. They need to be activated. They need to be educated. And it's up to all of us to educate those individuals in order to provide the best possible care for their loved ones.
And I will
Thank
add,
you. Oh, please, please.
I'm sorry, yeah, you say education is all about education, but I think what is also key, I feel that a lot of times we in practice, or we just verbalize it, yes, we inviting caregivers to be part of the dynamics. But when it really comes to implement what they bring into the table, their contributions, their perspective, I see that there's also a disconnect because we're really not utilizing the knowledge that they bring into us. And I feel that a lot of times we just say it to say it, but in reality, it's not being applied. And we create all these wonderful programs and services, indeed. But are they really influenced by the needs of the caregivers? Like that's what I feel at times. That we go with this structured questioning whenever a caregiver has an encounter with a professional. Are we really listening? Because I hear it from the people when we run in the support groups. And Dr. Noya is one of the participants at the support group that I ran here for HFC. When I had the support groups, when I meet with families or individual sessions, they are talking about having these encounters and not having enough time, not being able to speak up, not being able to talk because they just have to answer or check all the questions that they've been asked about. So I'm just like challenging this notion that yes, we embracing the presence of the caregivers, but a lot of times we don't. And it could be because our biases, it could be because of the protocols that we have to follow. For whatever reason, it could be unintentional. But the point is, it is happening because the caregivers are verbalizing it. They feel the emptiness and they feel it themselves. So telling them, yes, you have to be embraced and you have to speak up, they already have a lot of things in their plate. So asking them to be more empowered and more vocal, it could be adding something else. But yes, we talk about it, but we're not doing it in practice. So I'm sorry, that's how I feel and that's how I see it. And they're talking about it. So what can we do to really materialize the contributions of the caregivers, not just telling them what to do? Let's embrace and execute what needs to be done.
Thank you, Lisette. Jessica, if I may go to you on this next one, what advice would you give caregivers about advocating for themselves when medical or legal conversations feel overwhelming or intimidating?
Can I just make a comment on the last point that was just made?
Please.
Yes, Lisette, you're so right in the sense of not just listening, but what I would say is I would love for all professionals who are engaging with family caregivers, it's not just listening, it's orienting from a place of curiosity, right? Not assuming that you think you know their experience just because you work with families who are with people who are living with dementia. It's asking open-ended questions and believing that there is a story that has to be told to help to connect the dots, right? It's also trusting that the family caregiver doesn't just have the knowledge, but they're the ones that are there 24/7. They know the aches, the pains, the 3 a.m. worries, right? And so, how are we mining that to be able to really paint the full picture of not just what's happening, but like what are all the inputs in how this person is being cared for, which is the perfect segue into my response to your question, Jeff, is, you know, as an advocate for your person who is living with dementia, when you were navigating doctor's offices, hospitals, whatever it might be, I always tell folks that you are your person's eyes, ears, and mouth. And I'm not saying you're taking agency away from your person, right? Your person is a human. They are there, they hear and see everything. But it is now your job to come in with your documentation, all of your notes, your questions written down to slow down the providers so you can get what you need, be able to articulate what is it that you're noticing, what has you concerned. Your job as the advocate, it's more than an advocate. You were, for most people, you're the medical decision maker. Therefore, you need to be in every conversation. You need to be included in choices that are made, so that you're not just going home with your person that's been discharged, but you're going home equipped with the information that you need, the questions answered that you came with, but also feeling confident, right? And being able to carry forth whatever plan that's been set. I also think when it comes to advocacy, and I know that it is sometimes hard when you're entering a space where you don't have a lot of time, folks are rushing, right? Like you don't feel listened to. I encourage all family caregivers to take up space and be confident. No one is the expert besides you in that room for your person. So own it, believe it, know it, right? And when you position yourself that way, that swagger might feel overconfident for some, but it's necessary to be able to feel like you are engaging with the professional that's across from you. And therefore, they would also listen and hold space for you too. So that's my advice.
Thank you, Jessica. If I may start with you, Dr. Ayudaro, what do you want to say, for caregivers? What do you want caregivers in the room to know that doesn't get said enough in today's day and age?
Great question. The thing that I want all caregivers to hear, if you've never heard it before, is truly thank you. Thank you for being an advocate for the patient. If it wasn't for you, you help make the care that we deliver to your loved one so much better. So thank you for being the eyes, the ears, the person who can help us help the loved one. So that's two words. Thank you.
I love that. If I may too, as a physician yourself, doctor, what does the caregiver's relationship with you, how vital is it for you both to have good communication between one another?
It's extreme. It's extremely vital. It's honestly makes a difference between life and death. Honestly, there's things that for the individual that has dementia, they may not be able to recall the medications, what they're supposed to be on, symptoms that could change management. And if the caregiver comes and is bringing that information, it's literally helps with management decision making. Does this patient need to be admitted to the hospital for additional workup, observation? Do they now need to be transitioned over to assisted living? Do we need to escalate certain cares that we're delivering? And that's all because of the feedback or the account that we get from the caregiver. So it's truly life and death.
Thank you, Dr. Ayudara. If I may go to Dr. Noya real quick. Caregiving often means making hard decisions under pressure. So, Dr. Noya, what helps you feel supported or unsupported when those moments arise?
Well, I think I have the role of this, and I found, I feel most of the times very well supported. Um, for concerning, starting with my mom back in the 98, it's uh, we noticed her issue, that she was starting to have dementia when she came to visit us in Montreal, in Canada, from Peru. She would come to see us every 2 years, and that she was dysfunctional. Something was off, and it's my wife. I give credit to her. She's gonna hate me for mentioning her, and she's gonna keep me when we get back home. But she's the one who really picked it up. And then she also picked it up with my older sister. And so I had to tell my siblings and try to explain on what was this before, we had stuff. Um, anyway, so fortunately, they accepted it. In Lisette's group that I'm part, as she mentioned, have witnessed other participants that their family it's in denial, and that makes it awfully, awfully hard. Fortunately, I didn't have that experience. And with my mother, there was a point when she was not very aware of things, and she was getting pneumonias, and she was hospitalized a few times. And I had to tell my siblings, guys, we need to get her home, and we cannot be bringing her to the hospital because, it's not helping her. This, dementia was very advanced, and this is going to follow its course, and it's better if she's at home. And that was a very hard time, a very hard moment. But fortunately, my siblings understood, and that's what happened. Then moving on to my sisters, my I'm gonna mention my wife again. Sorry. But she's the one who, as I said, picked up that my sister was starting with this process, and she first convinced me, and then made the effort to bring in rope in the rest of my family with this. And she's now my sisters have a team of people that are taking care of her because she's here in Montreal. And that I have, my wife has been the architect of the team. She's put it together, and people that take care of my sisters at home. There's a friend who takes them to their medical appointments, and it has made it easier. So it's very little, very much supported that way. Uh, Tough times have been, for example, with the doctors that look after my sisters, because there's like a disconnect, that this person has dementia, and the friend that takes them with them is the caregiver that needs to give the information, but the doctors have a hard time accepting, and they want to say, no, you go out I need to see the patient alone. And that has been, I had to speak with the doctors from a distance and try to convince them of that. Even the neurologist that, supposed to make the diagnosis of dementia had a very hard time saying the A word, Alzheimer, that saying this is what's happening, was using uh euphemisms, and it's a doctor that's a dementia expert. So that's when I feel lack of support, let's put it that way, in that kind of instances. But for as I said, decisions hard that need to be made, imperatively and so on. I've been blessed with having this structure of support.
Thank you, Dr. Noya. Lisette, if I may come back to you really quick, how can professionals create space for caregivers to be heard as partners, not just participants in the process?
So I'm going to reframe that question because
Please.
you say, how could professionals create spaces? As a professional myself, I believe the spaces are already created. And I believe it's a matter of taking advantage of those spaces. And taking advantage of those spaces, I will say, how can informal caregivers, the family members, the friends, can take advantage of those spaces? And I'm going to say this not, again, not as a way to add to the long list of responsibilities that the caregivers already have, and also to the long list of responsibilities that we professionals have. But I believe that going back to, let's say, the title of this panel, it's about listening, learning, and elevating one another. Okay. It's about the professionals themselves because they have biases. They might see things from a different perspective too. So they have to not just tell the informal caregivers be empowered and do things. They themselves also, because they're coming with their own personal baggage too. So they also have to work with that. We all have to listen to one another. This is a gentle reminder because we need to create connections. And that's what's happening today more than ever. We had lost the connection overall. And we have to go back and look into that. We cannot listen to others. We cannot learn from others if we do not develop connections. We have to elevate one another. Every single opportunity a professional has, an informal caregiver has to create that connection with the other individual who's coming here to get your support, to become empowered. We need to take advantage of that, and we have to maximize that. There's no connections for me to come over here and start telling you my story. If you're not willing to listen, if you're just following a protocol that has been given to you, I don't have time to listen to you, Jeff. I don't have time to listen to you, Lisa, the caregiver, because I have so many other things. So let's be mindful at those connections, and let's give the opportunity to be ourselves without having to follow a script. A script. Just this journey at care is painful, and like I was listening before the first panel, the comedy. We had to see this from a different perspective. What's happening to the humanity. Not everything is a script. Just this is difficult, and we all have a different story.
Can I also add to that, Lisette?
Please.
Yes, sir.
I think, support the caregivers from the medical professionals will only go so far, in that we need support from different avenues. One is we need government support, which is, I would argue, lacking. So, and it's great to find that magic pill for the cure for Alzheimer's and related dementia. But the concerns and what we try to deal with, what we're all dealing with as we look for that magic pill and the cure for Alzheimer's disease, which will eventually we'll get there, maybe in our lifetimes, without my medical background, from what I am told, is that, we need to support the caregivers on the ground now. And that's what we do a very poor job. So it's a balance between the monies to support for research and a cure, and what obviously, that was what HFC does. It provides grants and support groups for the caregivers, which is wonderful. But we need more of that support, which is lacking. We need more of monies taken from institutional level nursing homes to a home and community-based setting, so we can give families that relief. And many of the families that I work with cannot afford $40 per hour for 8 hours a day for caregivers. It's just unaffordable for them. So we need support on the federal level. We need support on the state level for every state to have, family leave for elder care in addition to child care. So it's a group effort. It's us, the legal medical professions, but we also can't do it without support on the local, state, and federal levels.
Yeah. Support is reflected in so many different ways, Gerald. Many different ways when we talk about support.
And just to add to that,
Yes.
I think that is so key, is support, but policy changes to enact the support so that physicians are not pushed to spend 15 minutes per patient, so that we have resources in the community that is paid for and backed by the federal government, the state government, to support, give the resources that patients and caregivers need, and that is covered by insurance. Because that, at the end of the day, if you follow the money trail, it really comes down to what will insurance reimburse, then that's what we can deliver as part of our care. So if we start to push our policymakers to create health insurance changes so that we are adding things like the GUIDE program, respite care, home aid, social support services, compensating lawyers for their time to care for this dementia patient, then that's how we truly are going to reform healthcare and provide better care for caregivers and patients.
Thank you, Doctor. If I may start, this is going to be a round robin, whoever would like to answer, but I'd like to start with Jessica, if I may, on this one. From your own experiences, each of you professionally, what would you say is the greatest misconception around the dementia and Alzheimer's disease space today?
You said, what's the greatest misconception in the
Yes.
dementia and Alzheimer's space today? From my perspective, I think the first misconception is that it's just a short-term memory disease. And you're like, there's so much more to Alzheimer's than that, right? And I encourage people to never make assumptions that just because you've seen one patient living with a form of dementia or especially Alzheimer's disease, that like that is how everyone is. I think to tack on two, I know you asked me for one, but the second one I'll say is that like with a diagnosis, your world is ending. In fact, I've been on this journey for 11 years. There's been so much life lived and moments had and experiences and memories made. And so the thing that I'll just say is that just because you now have a dementia diagnosis, it doesn't mean that your world is over. It actually now means we have to think about how are we going to evolve and adjust and adapt to our new reality. But your person is still there. They're still human. They still feel and want to engage and feel joy. And it's our responsibility to cultivate and create those moments with them.
Thank you, Jessica. Anyone else want to share what they believe is the biggest misconception within the dementia and Alzheimer's disease space today?
I'll address it. Is that, a pill is not always the answer. I'm not talking about a cure. A pill for those with Lewy body dementia or FTD, in the sense that that's the easy way to go, is give them a pill and it will address their behaviors. They don't need a pill. What they need is our time, as was already mentioned. They need their handheld. They need to, even someone with advanced dementia, still the power of the human touch is still very important. They need our time. We need to spend time with them, not just the caregiver themselves, but anyone that, whether it's a physician based upon time constraints, or anyone in their sphere, spend time with them. If listen to music with them, the power of music therapy. It's not just a pill. There are so many interventions that we can address beyond medication. It's just that, like anyone else, it's time. But we need more time and there's ways to give them time based upon what was already discussed today.
Thank you, Jerry.
That was deep, Jerry. Thank you very much. I feel that you're taking over my job now. That's it. Behavioral approaches. And I work with neurologists and physicians in the medical field. So I do understand about the power of pharmacological interventions, but we have to start with those behavioral interventions, the power of touch, listening. And I'm going to take it farther. It's not only for individuals with any type of dementia, is for us, and I'm sounding repetitive because I said it before, the lack of connections, the humanity. We're so immersed in so many other things. So, what is the priority nowadays? Today, more than ever, right? Not only people with dementia, with mental health issues, so many other struggles that we're going through right now as human beings. Let's take the time for ourselves. Whatever little thing that we can do to detach from everything that's going on right now, to take care of ourselves, become re-energized, and then come back. And we hear from so many people telling us what to do, what not to do. But you know what? Who knows us better than ourselves, right? We should be able to identify what it is that we need. And we know. Now, the problem is taking the next step to do that something that will make us feel better, right? That's on us.
Thank you, Lisette. If I may start with Dr. Noya and Dr. Ayudar, excuse me. This last one, I want to start on an optimistic way here. What gives you hope when you think about the future of caregiving support and collaboration?
Well, I think we are big steps of I was just thinking before you asked me the question about misconceptions in dementia. There are many about dementia itself and the process and what patients need. But I think a major misconception is that the caregivers need a lot of support. And as Jerry was mentioned, the government should get into it and give major support for that, which is lacking. And I say baby steps because I'm very fortunate to be part of Lisette's group, and that has opened my eyes into what other caregivers go through, and how important this group has become for us as a collective, in listening to each other, supporting each other, and so on. So I think that's where it should go, for the caregivers, is yeah, I said baby steps. So, you need to grow up, yeah, and make it grown up steps.
Thank you, Dr. Noyer. Dr. Ayudaro, what gives you hope about the future of caregiving and collaboration?
The fact that we're having these kind of conversations, and as my colleagues have pointed out, there is more attention on caregiver burden, and making sure that we're supporting the caregiver from a health standpoint, because there's been numerous studies that have shown if the caregiver is doing well, then the patient will have better outcomes. So from a research, from a medicine standpoint, I want you all to know that we hear you. We know that we need to start paying better attention to our caregivers, and there are several physicians, including myself, who are advocating, who are trying to implement new models of care so that we are caring for not only our patients, but also the caregivers.
Thank you, Dr. Jessica Lissette or Jerry. Any thoughts on what gives you the most hope with collaboration?
You want to go for it, Jessica?
I can, thanks. I was gonna say the thing that gives me the most hope is that we're now seeing care in the mainstream, right? If you think about the TV shows that we're seeing, yes, of course, there's the pit, but now I'm seeing care in like the smallest ways. And I'm like, oh my gosh, when we have reached the point of being seen in primetime TV, that means people are talking about it. People now feel seen and affirmed, but also people are now getting like those extra pushes to bring questions to their medical providers, talk about it with family members and friends, right? I think that, care was never meant to be done in isolation. And I think that the more people tell their stories, the more people feel seen and connected, allows for people to say, like, oh, this is a community effort. And actually, the more I share, that means the more things might change. And so I think what gives me hope is the fact of like, we are now more vocal than I've experienced, even in my own 11 years on this journey, around who is caring, right? Like the spectrum of and the demographics of the people that are caring for folks, but also like the care experience, what caregivers need. And I think that's the most encouraging thing from where I sit, and gives me a lot of hope for what's to come. Hmm.
Thank you, Jessica Lissette or Jerry. Any thoughts for you on the optimism towards the future and present?
Well, to, just to echo what Jessica said, I mean, I think we're seeing more and more. There was a death doula on the pit. I was so excited when I heard about a death doula on the pit. But besides that, I think we're seeing more and more. It's in the mainstream. Alzheimer's is not to be shunned anymore. Uh, there's dementia friendly townships. There's certification for dementia friendly, and townships and cities are being more and more dementia friendly. We see different models of creative care, dementia village types, the greenhouse model. There's more innovation going on than ever before, and that's all good. But as we said before, we have a long way to go, but baby steps. But we're moving in the right direction. We just have it just advocacy, government advocacy on the local, state, and federal level, but we're moving in the right direction.
And
Lissette, yeah, please.
thank you, Jeff. I will be more, I'm becoming more optimistic because I see more, thanks to the advocacy and the awareness about the disease, I see more the efforts of the informal caregivers to be out there seeking support and services, and also to start working on brain health themselves. After witnessing the traumatizing experience at caring for someone, not only with dementia, with so many different type of conditions. Now there's becoming this opportunity to be more proactive, to exercise self-care, taking care of themselves because they know what the future could be, and being more into lifestyle changes, not only to care for that person, but also to take care of myself. So I'm optimistic about what the horizon is bringing into self-care in terms of the caregivers and brain health specifically, though.
I love that. We have 1 minute left. I want to give, just because we all love Hilarity for Charity and what they're doing here for CareCon. So if each of you, with your experiences around Hilarity for Charity, could say one word that you feel that HFC embodies today, what is that one word from your perspective?
Hope.
Fun.
I was going to say laughter.
Togetherness.
Dr. Noya? Oop, we're not hearing yet, although it seems like your audio is on.
Yeah, it's weird.
There we go. There we go.
Okay, yeah. So I said laughter. So Jessica said the same thing.
I like it. Laughter is much needed right now. So thank you, panelists, for being here. Thank you, CareCon. Thank you, attendees. Thank you, Hilarity for Charity. It's a joy to have you all here today. Stay well.
Thank you, Jeff.
Thank you, everyone. Thank you, Jeff, and everyone else.